Hey guys, and welcome back to The Advisor. I'm Lisa Urbanski, co-host of the show. Back with me today is Lidia Molinara. So Lydia is a pharmacist, a certified geriatric practitioner, a patient safety officer, and the founder of Mom's Healthcare Navigator. She lives in Kelowna, British Columbia, Canada. On the last episode, we talked about navigating the health insurance realm, which can be a beast because there's so many aspects to it. And if you don't read the fine print, as we talked about on the last episode, you might get some shocks or surprises that can easily be prevented. So go back and tune in to the last episode to hear all about that. Today, we're going to talk about preventing miscommunication with healthcare. So, Lydia, welcome back to the show.
Thanks very much. Glad to be here again.
Yes, yes. How is it going out there today in BC?
Beautiful day today. Yeah, it's like 19 degrees Celsius. Beautiful. Sun is out.
Yep.
It's gorgeous.
So, I woke up to snow. It was 19 degrees on Saturday. We did a community cleanup in the Exchange District, and then it was like I was in a tank top, and then this morning it was snowing.
That's Canadian weather.
Totally, totally. I love it. I love it. That was a great answer.
Yeah, that's what happens for sure.
Awesome. So it's good to see you again. And I'm really excited to get into today's topic because navigating our healthcare system is a beast, just like the insurance system, like I just mentioned. So let's get into the topic for today, preventing miscommunication with healthcare.
So basically, in terms of why this matters, right? Like, well, I just go and I speak to my doctor, and sometimes I understand and sometimes I don't. It's
Hmm.
the devil in the details, right? So, really understanding what is being communicated to you is going to make an impact in your healthcare. If you misunderstood and take two tablets instead of one tablet, that could potentially cause you to end up in the hospital in an emergency
Hmm.
ward. And we've seen this. So miscommunication isn't just about you not listening in the sense of understanding because you didn't hear it, but sometimes it could be because you didn't understand it. And so, like we talked about, there is a whole different language when it comes to healthcare. And these mistakes aren't just, oh, well, it'll resolve, it'll be okay. No, actually, without putting a lot of fear out there, if you think about it, it could be like three jumbo jets falling out of the sky in a year. I mean, could you imagine if that, when one falls out of the sky, it's all over the news? Can you imagine three? But that's the kind of statistics that we see with miscommunication only, not human error or not other things. One of the key drivers of issues in healthcare is because of this miscommunication. So to communicate, it takes two people. To miscommunicate, it takes two people. So how do you prevent this in your day-to-day when you're going to access healthcare? What are the strategies to use? And so that's basically what we want to talk about because it's really important to know these strategies so that you can ensure that you avoid these preventable errors. And that's what this is all about. You're going to have situations where errors happen, but if they're preventable, it almost is like gut-wrenching to think that something could have been prevented by one simple solution, right? Because there's hard enough trying to stay healthy and do all the right things. But this is also a wellness practice, something that you should be doing and incorporating in day to day to make sure that you stay healthy, right? So when we're looking at this, clear communication, basically breaking it down. When you go to a doctor, what are some of the things that you might ask, Lisa? Like, what do you say?
So I asked for a lot of clarification. So I asked, what are some of the things I should be doing? Um, Yeah, I don't know. What do I say? I listen. I listen when I go to the doctor, I guess. What should I be asking?
So really, preparing for your appointments is really important.
Oh, that I would if I was prepared.
Yeah. So really, one of the most important things to do is you booked an appointment for a reason, whether that
Hmm.
be a follow-up, a new concern, or a what, like a yearly, something that is a something like what can I say? A
Regular
yearly
checkup,
checkup. Yeah, something that's, on the books. You've got to
physical.
do this. Yeah, every year you're doing it, or every 6 months you got to go back and check something. It's like those types of schedules. So you've got those three options. When it's a follow-up, you're basically, what happened at the last appointment. You're now coming back. Maybe it's after a test, or maybe it's after you started a medication and you're following up to see how it's going. So I'm going to start with follow-up because everything's already established. And so the easiest piece of communication on follow-up is, well, you already had situation occur. You took a medication, you had some kind of a treatment plan, you were going to exercise for 3 months to see how it was going, or you're going to go to physio, something. Go back and see the doctor. You should be recording in between when you started the medication or that treatment plan to when you do your follow-up appointment. And the reason is because then when you go see the doctor's going to likely say, how is it going? Since we last saw you, you started this medication. Any concerns? And that's where you shine by saying, yes, here are my 5 concerns. No, no concerns, but it doesn't seem to be working, or I've noticed this or that. So if you have those documented, your communication to the physician is going to be so much better. And the more truthful you are, the more clear you are and concise in the sense of when he asks a question, you answer that question and don't go off on a tangent because 15 minutes goes by very quickly. That will prevent a situation where if you say, yes, I was supposed to be taking that medication once a day, but you didn't take it, and then they check your blood pressure and it's high, the doctor's going to say, oh, I might have to add another one, or oh, we have to increase the dose. Versus you just saying, this is how it's going. I don't like that medication because it's been giving me bad headaches, so I didn't continue to take it. And that's going to have a much better outcome for you than not telling the doctor that, because now he's going to increase it or he's going to change it to another medication, whatever that looks like. So being clear, concise, and truthful is really important on those follow-ups. Track what's happening in between and then present the follow-up. If the follow-up is, we wanted to just see how these test results were, you book an appointment to go back and see, why are you there? Doctor has, maybe 1,000 people on their panel in their office, in their
Mhm.
clinic. They are not going to remember exactly why. They're looking up on their computer, why is this person here? And then you're going to have to say, I'm here to follow up on my labs. I went and did this, that, my screening, whatever it is. And then the doctor will look at it and you guys can discuss it. Oh, everything's clear. Oh, I see a problem here. We got to deal with this, whatever that looks like. That's your follow-up. So when you go originally to the doctor with a concern, it kind of mirrors what happens in a follow-up. You should have your signs, your symptoms, the severity, what is it, pain-wise, 1 to 10, how many times it happened in the month, and the dates. So that when you sit down with the doctor, you say, I've had a headache for the last 5 days. I've had, a bad cough in the last 10 days. My swelling has gotten worse, whatever it looks like. And then you can have a discussion about your signs and symptoms or what's troubling you. And what I'm going to say about communication, because it's a very short time frame and you'll see the doctor typing away, you want to ask 3 vital questions. Whatever is on your mind, keep it to 3 questions because likely if you keep it to 3 questions, you're going to address all three. I just sort of think 5 minutes for every question, you'll get through all three. If you go in with a list of 20, you will not get to them. And maybe your 19th question was your most important, right?
Mhm.
So that miscommunication leads to you not answering a question that's important, which then means potentially you mix up something or you don't follow something and you end up in hospital, which we see.
Right.
So
Right.
why it's important when you see the physician or if you go see a dentist about, you have to think of it the same way. When you go see a dentist and he says, why did you come in today? You're not going to say, well, I'm not sure. I sort of have trouble in my teeth. You're going to probably pinpoint which one, right? And ease your
Mhm.
situation. Because it's in your mouth. It's not 15 other things it could be. It's something where it's hurting in one specific spot, but you've determined that over a period of time, and that's why you went and made the appointment. You have to think of your body the same way. There's going to be signs and symptoms of what you're experiencing. Put it all together so that there's a better picture. The pieces of the puzzle come together much easier the clearer you are. So that's where you want to stick to. Three really valid questions. What could those be? Well, doctor, I am feeling XYZ. It's happened to me this amount of times. I'm concerned about this. What tests should I do? What do you think it is? What is it going to resolve? What do you feel I could do about this? Then you'd want to say, this is really impacting my life in this way. What shall I do? How can I do things outside of medications or outside of drug therapy that I can incorporate every day for this? I don't know. It could be many things. Or you could say, should I be tracking different things? Should I be watching for different things? Should I be eliminating certain foods? What are the things that I should be doing in order to try and confirm or get to a diagnosis? And that's kind of, your three important questions. This is what I'm feeling. How can I make a difference in my life with this? And what are my other options in treatments? And that's how you'll kind of understand where to go from that. And then when you're doing your preventative screenings and you go in and see the doctor, the communication on that is simply, I'm here, I need my requisition for my mammogram, for my, colonoscopy, whatever that is. That's what you're going to then explain and talk about and book a follow-up if there are those tests being done, because sometimes, we don't always follow up properly and we need to. We
Hmm.
need to get sure what the answers to those are, and you want to just go in and see the physician and say, I'd like to follow up on my last tests. They were XYZ. I did them XYZ days. Because then you can just quickly go in and look and you're saving time. So that miscommunication of looking at the wrong one goes away as well. And then you're
Right.
targeted on which one it is and you get the answer to that. So that's kind of how I would prepare for the doctor's office. When you're in the doctor's office, your communication, active listening, which is what you said. I usually listen, which is really
Right.
important. Active listening is all about engaging, lean in, listen to the physician, write down what they're saying in order for you to stay
Hmm.
focused, and then maybe when they're saying something, you might have another question. So try and keep the conversation going. Stick to the actual conversation, those three questions that are the most important to you. Listen to what the physician is saying to you and see how you feel about that. If the physician says, I think we should start this medication, you're going to ask the question, why, how is it going to work? And you're going to go through all of your, why, what is it? How is it going to work? What should I be doing with it? How should I take it? All of those things. And when should I come back? Why would I stop it? Those questions are incredibly important because, again, miscommunication. If you're starting on a medication and you say, yes, but I also take this one, will it interfere with it? Really important question because the doctor might not have your whole list or might not understand that you're still continuing that one. He probably thought, oh, it's not on my list. I thought you stopped it. We see that. So it's really important to ask when you're getting put on a treatment plan from that interaction. What is the treatment plan? How is it going to work? What should you follow up with? What should you be monitoring? And that's also really important in your communication. So that's kind
Mm.
of the active listening part of it. Then when you look at, well, we talked about not understanding sometimes, physicians talking in words that we don't understand. Stop. I always say stop, pause, and just say, can you explain that again? I don't understand.
Mm.
Be honest with it. This is really important. If someone is explaining to you how to do a bungee jump off of a cliff, you don't understand. You're not going to say, nah, I'm just going to go anyway. You're going to be like, what did you say? I don't understand. This is just as important. Your health,
Hmm.
we don't feel like we should be speaking up necessarily. But when you don't understand something, there's absolutely nothing wrong with saying, I don't understand. Can you re-explain?
Mm.
And that's a really good step towards eliminating miscommunication. Because if you understand it, you're obviously going to be able to implement it better and do it better. So that's another really important question. Ask the clarifying questions. What does that mean? I don't understand what that means. And then repeat. So do the repeat and rinse in the sense, when they said have to take this medication 3 times a day, you say, oh, you mean I have to take it like in breakfast, lunch, and supper. Relate it to your day to day. So then you know that you've actually interpreted it correctly.
Yes, I like what you said about like being prepared and having like everything written down too. Because I know a lot of times something's happening and then I go see the doctor and I forget. I walk out of there going, oh my God, I totally forgot about this, right? But if I
Mhm.
had it written down with my schedule, list of my supplements and the stuff that I'm taking already, then you can just literally hand that over to the doctor and then they can read it themselves. So even if I'm like, oh no, I didn't listen fully to what I was supposed to do, or I didn't take this as regularly as they told me to do, sometimes I feel almost embarrassed by that. But you're right. If we're not completely honest and clear with them on like the truth of what's happening in the moment, they can't help us fully. They won't be able to do what they're supposed to do, right? To help us if we're not completely transparent. So I like the idea of writing everything down and then you could just hand it to them even. I don't know. If you're embarrassed about not listening, just hand them it and let them read it. And I mean there's nothing to be embarrassed about, right?
No, actually, we as healthcare professionals, like as a pharmacist, if I thought us humans were perfect and everyone takes the medication exactly like we told them, that's probably more not happening than it is happening. And we're not
Hmm.
we're not oblivious to that. We get, even in my own, I'm a pharmacist, even every day myself, I'm not exact every day taking my medication at the exact same time every day, right? Like it's not like that. I mean, I take a multivitamin and some days I go, did I take that already? Right?
Hmm.
So
Right.
it happens with us, and there are strategies, the more medications you take to help with managing medications. But the point is, just being honest and saying, you know what, I kind of only take that 2 or 3 times a week. I don't take that all the time. And we also see, the medication listed, it's supposed to be 3 times a day. And some people will say, I only take it twice because I find that if I take the extra one, I get more nauseated or I get dizzy. Well, sometimes we do your labs and you taking it twice a day works for you. Nothing needs to be changed, right?
Mm.
So that's fine. You end up in hospital, someone sees your med list and you're taking it 3 times a day, they're going to add the other one to it. So really being honest about that, then it updates your medication lists, and then you can go in with an accurate medication list. So
Mhm.
prescribed versus actually taking. You want to have the list of what you're actually taking and how you're taking it. That's the list that's the most important. That will eliminate miscommunication on something as simple as medication list.
Mhm. Yes, that makes a lot of sense.
Now, the other thing that we can do with when we talk about labs and following up labs, the nice thing with technology is now we have the ability sometimes to go into patient portals, right? So
Mm.
you can go in and you can look at the lab and see if it's above or below and see what that looks like. Book an appointment if something says high. You can do a little bit of research. I wouldn't necessarily panic about it because it is all about the bigger picture, right? Something looks a little high or a little low, that doesn't always mean something terrible. It just means something is happening and we need to look into it, right? Uh,
Hmm.
and it's really about interpreting things properly. Like if you have low iron, you might have low ferritin, but then your hemoglobin is okay. So then we're not as concerned as if both were down. So there's all of these things that, you need to obviously follow up with a healthcare provider to ask those questions. Sometimes, pharmacists are an invaluable part of your healthcare team. They can also help you analyze and look at labs. Now, different states and different provinces in Canada, they might have different roles that pharmacists can look into these things or not. But if you have your own portal, it's a really good place for you to log in, to look at these things and give you a little bit of peace of mind. Oh, I went, my mammogram says normal. I'm good. I really don't need to spend my time going back to see the doctor. I've read it. It says it's normal. Or you say, you know what, this is what I have. You go back to see the doctor. The doctor says, oh, my results show this. You can turn around and say, oh, in my patient portal, it shows this, in case there's some miscommunication in that regard, right? So
Right.
it's also important for you to double check your information to make sure it's accurate and to make sure it's correct. So that's when those patient portals, those are actually really invaluable. Peace of mind, you get your results quicker. And also, it'll motivate you to know if the doctor's office calls. Sometimes they'll call and they'll say, we want to see you based on your lab results, or we want to see you based on your test results. And then you kind of get into a panic thinking, why? What did they find? Right?
Hmm.
And that this happens. So this way you can check yourself, you kind of have some peace of mind, or you know what you're discussing. You can research it ahead of the appointment. You can look into what that means. You know, what should you ask then? And you have an idea rather than going in and someone saying, "Oh, I noticed your vitamin D levels were low, your bone density is low, so this is what we're going to do." When you've read all about that, you're going to say, "Well, actually, I read about this. Could we try this? Or what about this? Or I saw this. Does that work for me?" You know, that kind of thing. So you have a little bit more
Right.
information.
So I have a question. I didn't even really know about patient portals. Like, what are some examples of different apps or websites that utilize this?
So it all depends, but sometimes when you are like in the province of Alberta, there's like the My Alberta Health app. In
Okay.
BC, where the government will put some of the information on an application and you can download it. The other thing is if you're part of a managed care network or if your insurance company has applications, I would download those because again, if you're going to a certain provider, they could upload into that portal and then you could have access to it. So it's a really good question to ask and find out. Sometimes physician offices or, clinics will have patient portals where they dump the information and you can research it and look for your own name in there. And they are, considered, of course, private and secure. And there's
Mm,
probably, all those two-factor authentication things and rules, but that's where you can keep some of the health information.
that makes a lot of sense. So would prescription refills and stuff be on there as well?
Well, there's some pharmacies that definitely allow you to refill prescriptions right through a refill reminder program, and that will
Mm,
help too with saving time. You go in and you see you have a refill and you can refill it. Absolutely, that's available to you as well. And that's a really good point that you bring up because sometimes if you look and it says zero refills, then well, there's no point in me going into the pharmacy and asking for a refill when there isn't any. I'm going to have to go see the doctor or I have to speak to the pharmacy to get them to fax the doctor or whatever that looks like, right? So
mhm.
that's also really important to do. Or if you notice a medication that you should be taking isn't on the list, then you'd want to be asking, well, I'm sure I brought in a prescription for that. Maybe it didn't get put on the computer yet. And so you want to follow up and make sure.
So I was always curious about that because I know that when I was taking prescriptions, there was always like three refills, and then they would want me to go back and see the doctor. Or is it is that for a reason? Like they want you to go back to see the doctor after a certain amount of refills, or can the pharmacist just keep requesting your refill?
It all depends. It sort of depends on your condition, number one, and it depends on the physician.
Hmm.
And it depends on what kind of drug it is. So
Got
when
it.
we talk about narcotics,
Hmm.
like codeine, painkillers, fentanyl, all those narcotic type medications, even controlled substances, so things for ADHD, methamphetamines, a lot of times they're not allowed refills. They're allowed what we call days supply, and then you're allowed so many in that day's supply. So maybe the doctor prescribes 120 capsules and you're allowed to release 30 capsules every 30 days. So there's restriction.
Hmm.
You can't go in and say, I'd like all my 120. It won't be allowed, right? So those
Right.
intervals, that's set by the physician. Pharmacist doesn't set
Mm.
those rules. Refills is the same thing. If the physician is starting you on a medication and wants to see high blood pressure medication, wants to see how you're doing with it, he might only give you 30. Or he might
Mm.
give you, 30 with two refills, and then at the 90-day mark, you have to go back and double check and see how things are going. It's a way for the physician to follow up to make sure you're doing okay, and for you to speak to the physician as well after those refills, to see, well, should I still take this? Do I still need this? There are a lot of
Mhm.
medications that we see people on for years and years and years because the doctor might write a refill and then the pharmacy just keeps refilling it. Certain medications we can do, but there's no necessity for that. And I mean, I saw that many times when I was doing care plan reviews where I'd say, you're still taking this Pantaloc. It's been a year. Do you still need this? Do you still have issues? Like, is this still on? No, that was only supposed to be for 30 days. Oh, okay. Well, you're still taking this. So that's kind of, there's certain things where we can look at that. And that's the reason for the review. Usually doctors will write refills or no refills, and at that point you should go back and see the doctor. Some pharmacists can extend the prescription, which means we have the legal ability to rewrite it or extend it for 30 days or for, 15 days if you don't have a prescription. But most often, when the doctor has written that amount of refills, that's when you should go back and see the doctor for more.
Yeah, that makes sense. So then just to get a healthy checkup and so you know if it's working for you, next steps. And I guess that brings us to the next point, kind of sort of. What about like creating a family health history? Because I
Yeah.
think that has a lot to do with like current condition in our lives as well.
Right. Well, two parts. So first is knowing family history because
Mm.
certain preventative screenings do come into play when you know your family history. So if you had a parent that had colon cancer, you likely will start screening earlier. If you had a parent that had breast cancer, same thing. They might require you to screen earlier. If you had a parent that had breast cancer, or a family member like an aunt or something like that, then they might say, well, for hormone replacement therapy, we may consider this medication versus that medication. So when you're asked about your family history, you want to know as much as you can because that helps determine what treatment plan is going to be then decided upon for you in your particular situation. So it is important to have a family history written down so you know it. It's important to speak to your parent about it, to understand, have it in a journal. I always say you should have your family health journal. Each child that you have
Mm.
going on, your grandparents, your parents, any aunts or uncles that had certain disease, because you're going to be asked these questions. At some
Mm.
point, you're asked these questions. And if you say, I don't know, again, that piece of the puzzle is missing. So
Hmm.
that's the reason why we like to have all of those pieces together. The second part of it is, if you're in a situation where a child has to be brought to emerge and you as the mom, let's say you know all of the information, you're not there, a babysitter is looking after or a grandparent is looking after the child. It's so nice to say, if anything were to happen, here's the family health journal, right? It's kind of
Hmm.
like, this is it. You pick up the journal, somebody has a question. What you said in the beginning, you just hand them the book, right?
Hmm.
What are the
Sounds
allergies,
beautiful. Yep.
right? Where they
Here you
are.
go.
That's it. What are they on? What medications? Well, here you go. It's right all in and so all that guesswork, the franticness, the stress of what to do and what to answer, that kind of just goes away because it's clear. This is everything that's happening. And I
Hmm.
personally had this situation happen where I was at work, the caregiver for my daughter, she had to go in to emerge and she had the book. And the reason why she had the book was because the time before we didn't have all this information. She's trying to get a hold of me and I can't answer the question. I'm trying to get to the hospital on time. It's upside down. And what are the allergies? What aren't the allergies? So imagine now if you're in an emergency situation. And it was, my daughter had hurt her leg and we didn't know if it was broken and they needed to know her allergies. They had to give her an antibiotic, IV. And so by her having the information, simple. No back and forth. She took her. She knew exactly what was going on in the sense of here are allergies. Here's what medication she takes. Done. Right? Versus we're now at the hospital. let's try and, as a healthcare provider, do you know the allergies? No. Do you know the child's weight? No. Do you know if the child takes any medications? No, don't know. Okay, as a healthcare provider, we're like, okay, well, here's what we're going to do, right? We're
Right.
going to try this because what other option do we have? We have to
Hmm.
try something. So we try something and then they have an allergic reaction. Okay, now there's a rash all over the body, or there's worse. And so this is why these things are important because you just avoid all those preventable things that
Hmm.
cause more harm or cause non-optimal health outcomes.
Beautiful. And photocopy that book. You got to photocopy that book.
Really,
Give
I
one to
mean, yes,
everybody.
yeah, you need to have it in a safe place. I kind of feel like for me, it's like the first aid kit and the healthcare journal sit side by side.
It's so important and so smart. I never thought of it this way until you and I have been speaking, and it is so important. It's so simple and
Yeah.
it's such a powerful tool. Because what if I'm not feeling my best and I can't like speak about my
Mhm.
situation fully, right? And that's when we, unfortunately, when we go see doctors sometimes is when we're not doing well. So that's a lot of pressure to remember all that stuff. So
Mhm.
yes. Amazing, amazing. Let's talk about medical jargon.
Well, lots of words get flown around when we talk.
Hmm.
I want to talk about two things to this. Number one is we talk about healthcare being a different language, but we also have to talk about words that seem on a day-to-day basis like it would be insulting if we heard it. If a physician turns around and says, "Oh, I can notice," and is talking to the nurse, write down that the child has SOB, and you're thinking, "What in the world? They're not." What is that? Or, what is that supposed to mean? What's SOB? It's shortness of breath, right? Like there's
Right,
things that we say that sometimes sound rude or not nice or that we're criticizing. And I've experienced that before where somebody says, "Well, why would you say that?" And I'm like, "Oh, it's just short for this."
right.
Right?
Yeah,
Like bid is not bid, it's BID in our world. And BID means twice a day. Right?
right,
So like, oh, the doctor wrote, BID, and you're thinking, bid? What does that have to do with my medication? So sometimes you also have to think to yourself, the pieces of communication that we use are not something where it's being offensive. They are words that are short, sweet, and in this essence, like abbreviations that we use on a day-to-day basis that we don't even think outside of what somebody else would think those words are. I never thought BID was bid ever until someone said, "What does bid have to do with it?" And
right.
bid? What's bid? Right?
That's
It's
funny.
it's twice a day. So sometimes,
What
these are the words that
does that
come
mean though? What does BID stand for?
twice a day.
But twice a day. So what is, okay, now I'm even more confused. B, what does B mean? Or it's not an acronym. It
No,
just represents twice a day.
exactly.
Okay.
QD is once a day. BID is twice a
QD,
day. Yeah,
QD,
TID. Yeah. Right. So,
PID is 3 times a day.
yeah, TID is three times
That
a
would
day.
make sense to me.
Yeah.
That would make sense to me.
Yeah, because it's T with three. And then QID is four times a day.
What?
Yeah. They're all Latin. So it's all Latin. And so
Oh,
this is
okay.
how we write prescriptions. So doctors don't write out, take one tablet four times a day. They'll write one tab QID. And then
Hmm.
AC is before meals or PC or like so there's all these like abbreviations and words that sometimes you're like what does that even mean? And
Hmm.
that's because we're talking in code, we're talking in our
Hmm.
code. So there's nothing wrong with you saying don't understand what that means. You know,
Right.
we don't think about it. And I'm telling you that we don't think about it. I don't remember what I knew and didn't know when I was in my first year of pharmacy. I know what I know
Hmm.
now, and I talk in that terminology because
Hmm.
that's my language. So, that's why I say it's really important for you to break it sometimes for us and say, I don't know what that means, or, we might say something like, well, you're an excellent historian. And you're like, well, I don't know anything about history. Like, what
Mhm.
does that even mean? Well, an excellent historian is someone who has all of their beautiful journal charted. And when somebody asks a question, that's all answered. And so we might, say, I've heard physicians say, wow, you're an excellent historian. And then you hear after you walk out of the room them going, what does that even mean?
Right.
Excellent is great, but what is a historian? What's going on? So there's these little sort of nuances when we're speaking that you will not necessarily understand. No problem. You should be just saying, I don't understand. What does that mean? Simple as that,
Right.
you know,
Right.
and not
Yeah,
be
it's
offended.
just not be offended by it. Right. It's yeah, you're right. Sometimes it's tough. I remember starting a job and I was sitting there getting briefed on the business and they were using all these acronyms and I was like thinking in my mind, am I supposed to know this stuff already? Right. Like I had no friggin' clue. And so I remember saying to her, like the next day, 2 days later, I'm like, could I get all those acronyms on a piece of paper, please? Because I had no clue what you were talking about. But in the moment, of course, I didn't say anything. Um, but now I would. That's hilarious.
So that's really important on that part. And then just really like when you have some of these terms and terminologies or even the names of the disease states and you're not quite sure
Yes.
how to spell it, how to spell the name of the medication, just ask, how do you spell that?
Mm,
We're thinking that you might have osteoporosis. Okay. Can you spell that for me? I don't know how to spell
hmm
that. So how are you going to go back and do your research if you don't even know how to spell the word? So just like you said with the acronyms, can you write it down for me? Or can you please tell
hmm
me? And that takes 1 minute, literally 30 seconds, right? This is, the doctor can write it for you, or you can ask the receptionist, can you give me a sheet of paper, more information about what the doctor told me I had? And usually they have that and they can give you that information. So you can go back and do some research, think about how you want to incorporate the key critical things that you can do, like in your lifestyle to help you resolve some of these things. And that's how you want to make sure that like what is the name of the medication? What is the name of the disease state? How, like when they're explaining something and you don't understand, what is it that they're saying? And really just coming into the world of healthcare by explaining that you don't understand and by trying to get that understanding.
hmm Yeah, that's so important. So what about follow-up communication?
Well, we talked about that in the beginning, and I think what's really important is making sure you schedule your follow-ups because you
Mm,
also want to know why you should follow up and when. So you're at the doctor's office. I'm just going to carry on with osteoporosis. You've been diagnosed, you went and you did a test. It shows that you have low bone density, but you just need to take your vitamin D, K3, whatever that looks like. The doctor says this is your treatment plan. You say, okay, I'm going to go away with doing that. Then the question that you should ask is, when should I come back?
mm,
Because you might not have that question answered and you might not follow up for 2 or 3 months because the medication you're taking is an over-the-counter medication. So you want
mhm,
to know when do you have this retested? Is it in a year to make sure things are better? Is it in 3 months? Is it in 6 months? Because you don't want to leave it for 2 years and then find out that now you need more invasive medication or stronger medication because you should have been upping the dose and you didn't know because you waited too long to find out to retest. So it's really important to know those things. What is the follow-up? When I'm taking an antibiotic, okay, should I come back in 10 days? Do I, come back in a month? If this doesn't clear up, what do I do with my high blood pressure? What do I do? Take this medication for 30 days, come back in 90 days. What does it look like? So
mm.
know that because if you don't know that critical piece of information, your follow-up could be a lot later and it could create problems for you because of that.
Yeah, and I'll add one piece to that and keep it as like a non-negotiable. If you have a follow-up doctor's appointment, go to that appointment. I know so many times I'll have a follow-up appointment and I'll keep pushing it back because life gets busy. But this is our health we're talking about, right? So we have that appointment scheduled. It's a non-negotiable. Go into that appointment so you can figure out your health and prioritize yourself.
Right. Right. And that's where, when we look at the whole scheduling of things, you want to also look at encouraging family participants to help you with some,
Mm,
especially as a mom, you have, children that you have to pick up from school or drop off or take to daycare, or, you need to make sure that they're at this function, whatever that looks like. You need to try and say, okay, you know what? I have a doctor's appointment in a month. I'm trying to figure out who can help me with that. Like actively involve your family for some of these things, or, other caregivers, because sometimes they're doctor's appointments that you don't want your children in there with you on. There's certain
mhm,
procedures, there's certain things. So you really want to make sure that you have these things scheduled and that you have the support from your family. And that also helps with decreasing miscommunication, because when your family is involved and knows things, let's say for your child, your husband knows the allergies, your husband knows which asthma medications to give at what time. You you relieve the pressure on yourself having to manage all of it. And so if you're 20 minutes late, oh my goodness, now they didn't get their medication and now I don't know. Like, no, have resources in place and have, those sit downs just like you do planning a vacation. Plan what needs to happen now when this child is on this medication for 10 days. Who's going to be able to do it? Is it at the school? Is it at the daycare? What do you have to give everyone? What's the information you need to give everyone so that there's no miscommunication amongst the caregivers as well?
mhm. Yes, that's so important. And yeah, they can take care of, if more people know about it, then they can ask you about it, hold you accountable. That accountability piece is so huge.
Exactly.
So, Lydia, do you want to tell our listeners where they can find you, a little bit about your website?
Right now, I'm at www.lidiamolinara.com. I'm on Instagram at Mom's Healthcare Navigator, and I am currently working on an ebook, my course, so that we really go deep into some of these concepts with examples and checklists and things like that as well. So that'll all be coming up on my website.
Amazing, amazing. What about one last tidbit of information for the listeners? What do you want to leave everyone with today?
I really think it's important that you realize you are an active participant in your healthcare. Remove the notion or the thought that healthcare providers know everything, have everything charted, have read everything, so that the responsibility lies on them. In fact, it's the opposite. No one knows your body better than you, and you want to
Hmm.
be actively engaging, which means bring to the attention of any and all healthcare providers your concerns, your information, and keep in track that so that you can give it in a clear, concise, and truthful manner.
Hmm. Thank you so much for being back here today, Lydia.
Well, thanks for having me. I always appreciate spreading the word.
Yes, and you sure did. A lot of really, really valuable information there on directly communicating and being prepared for our appointments.
Exactly.
Amazing. Well, and thank you, listeners, for tuning in. Before we go for the day, I just want to thank our sponsors, Spreaker and iHeartRadio. Without you, this conversation would not have been possible. And I look forward to next time, Lydia.
Me too.
All right. Bye, everyone.